Good morning and welcome to New Employee Orientation. My name is Michelle Harris and I am an instructor with Workforce Development, which is within the Office of Human Resources. First, I want to thank you all for accepting the challenge to assist us in our expansion of contact tracing in the Commonwealth. Your efforts will play a key role in preventing further transmission of the virus and also ensuring those who have been exposed receive proper care, treatment, and also resources. During our time together today, you will receive an overview of VDH, including our mission, vision, and strategic goals, as well as important HR policies that you need to know. We will also provide a short training presentation on contact tracing. This will serve as an introduction to the required training you will be required to complete over the next few days. So at this time, I will turn it over to Eric Barton, who will get us started.
Good morning. I'm Eric Barton. I'm a policy analyst within the Office of Human Resources, and I'll be giving you a presentation on policy here at VDH and an introduction to VDH as an agency. I'd just like to say welcome and that we're glad you're here to support the VDH mission. So first, we'll be going over our agenda. We'll be going over a quick overview of VDH, which includes our mission as well as our strategic goals. And then we'll also look at our organizational structure. Moving on, we'll go over some policies that we'd like you to review and some required forms, which include acknowledgements of receipt that just let us know that you'll have read and acknowledge the policies. These policies include our alcohol and drugs policy, our civility in the workplace policy, our equal employment opportunity policy, some agency-specific policies, including our code of ethics policy, the confidentiality policy, our use of electronic communications and social media policy, and our information system security access policy. Finally, we will go over our safety policy, which is our VDH driver safety. Our VDH mission is to protect the health and promote the well-being of all people in Virginia. The agency vision is to become the healthiest state in the nation. And our agency core values are that our culture values service, equity, and making data-informed decisions. Moving on, we have our VDH strategic goals. These were developed in our VDH strategic plans, which if you're interested in reading more about, you can find that on the VDH intranet. Goal 1 is to maintain a competent and valued workforce. Goal 2 is to foster healthy, connected, and resilient communities. Goal 3 is to be a trusted source of public health information and services. Goal 4 is to assure the conditions that improve health opportunity. And goal number 5 is to provide internal systems that deliver consistent and responsive support. Moving on, we have our organizational structure. You can see here that at the top of our agency head is Dr. Norman Oliver, who is the State Health Commissioner appointed by Governor Northam. Under him, we have the Office of the Commissioner, which includes the Office of Human Resources and the Office of Internal Audit. Below the Commissioner, we have 5 Deputy Commissioners who each run a separate section of the agency. The first being Administration, which is currently led by our Acting Admin Deputy, Michael McMahon. This includes the Office of Financial Management, the Office of Information Management, the Office of Procurement and General Services, the Office of Shared Business Service, and finally the Office of Vital Records. Next, we have Community Health Services, which is led by Mr. Robert Hicks. They include all 35 of the health districts in Virginia and make up the largest portion of the agency. Next, we have Population Health, which is headed by Dr. Lori Furlano. This includes the Office of Epidemiology, the Office of Family Health Services, and the Office of Health Equity. Moving on, we have Public Health and Preparedness, which is led by Dr. Param Jabari. This includes the Office of the Chief Medical Examiner, the Office of Drinking Water, the Office of Emergency Medical Services, the Office of Emergency Preparedness, the Office of Environmental Health Services, and finally, the Office of Radiological Health. And last, we have Governmental and Regulatory Affairs, headed by Mr. Joseph Hilbert. They conduct all of our legislative and regulatory activities at the agency, and they include the Communications Office as well as the Office of Licensure and Certification. Okay, so we'll move on and get to some of the forms which we'll need you to sign and get back to us this next week. All of the policies that we'll go over today include certificates of acknowledgement. We'd like you to read and sign the required certificates of acknowledgement and turn them into your HR point of contact within 1 week. This includes all the policies we'll be going over today. If you'd like to reference back to this slide, we have links to the policies as well as a link to the certificate themselves, or where you can find the certificate of receipt within the policy. Okay, so moving on, we'll get into some of our general HR policies. We'll start with alcohol and other drugs. It is the policy of VDH and the Commonwealth of Virginia to establish and maintain the workplace free from the adverse effects of drugs and alcohol. All employees must abide by the following. Employees may not manufacture, distribute, dispense, possess, or use alcohol or other drugs in the workplace. Employees may not be impaired from the use of alcohol or other drugs in the workplace, except the use of drugs for legitimate medical purposes. If you're using a medication which causes side effects such as drowsiness, please let your supervisor or your HR point of contact know as soon as possible. Employees are prohibited from which results in criminal conviction related to criminal drug law, either in or out of the workplace, or violation of alcoholic beverage control law or driving while intoxicated law based upon conduct occurring in the workplace. Employees must report any conviction as defined above within 5 calendar days of conviction to their supervisor. Below, you can find a link to our alcohol and drugs training within Train, our learning management system, as well as links to the policy on the Department of Human Resource Management's website and a link to the certificate of receipt. Moving on, we have our civility in the workplace policy. The purpose of this policy is to ensure that VDH provides a welcoming, safe, and civil workplace for our employees, customers, clients, contract workers, volunteers, and other third parties. Its purpose is to increase awareness of all employees' responsibility to conduct themselves in a manner that cultivates mutual respect, inclusion, and a healthy work environment. This policy includes prohibited conduct, which includes harassment, workplace violence, bullying, and retaliation, as well as providing definitions for the various types of harassment, workplace violence, bullying, and retaliation. Within this policy, you can also find reporting. Below, you can find a link to the training for civility in the workplace on our Train learning management system, as well as links to the Department of Human Resources Management's website where you can find the full civility in the workplace policy. Next, we have our equal employment opportunity policy. The purpose of this policy is to provide that all aspects of human resource management be conducted without regard to race, sex, color, national origin, religion, sexual orientation, gender identity or expression, age, veteran status, political affiliation, or disability, in accordance with the governor's executive order on equal opportunity and state and federal laws. This policy ensures that all employees and applicants have an equal opportunity for employment. This policy also provides definitions for disability, as well as bona fide occupational qualifications, as well as the procedures for reporting any violations of this policy. Below, you can find a link to the governor's executive order on equal employment opportunity, as well as links to Department of Resources Management's equal employment opportunity policy and VDH's equal employment opportunity policy. Next, we have some of our agency-specific policies here at VDH. We'll begin with our Code of Ethics. The purpose of this policy is that each VDH worker demonstrates the agency's Code of Ethics, core values, and commitments with uncompromising integrity in all aspects of their work. The Code of Ethics is the foundation for accomplishing the VDH mission delivering public health services, and inspiring the public's trust in VDH workers. Our agency core values include accountability, communication, confidentiality, diversity, equity, excellence, integrity, objectivity, respect, and stewardship. Moving on, we have our agency commitments. These are to obey the law and comply with policies and procedures, promote a positive work environment, work safely, promote health equity, maintain confidentiality, carefully negotiate contracts and records, avoid conflicts of interest, neither give nor receive any illegal gifts, report suspected wrongful conduct promptly, address confirmed misconduct in a consistent and appropriate manner, and protect the agency's financial assets and resources. Again, below you can find a link to the relevant training within Train, our learning management system, as well as a link to the VDH Code of Ethics. Moving on, we have a confidentiality policy. So the purpose of this policy to protect confidential information as it is collected in protected health information, PHI, and personal information, PI. This policy covers the handling and management of all confidential information by VDH personnel. Only collect confidential information when it is authorized by law or regulation or deemed necessary to further a public health purpose. Access to confidential information should be limited to personnel with a legitimate work-related need to access it. In addition to physical security, confidential information must be routinely reviewed for quality, accuracy, and reliability. If in the course of your job you receive a Freedom of Information Act, FOIA request, please forward that request to your supervisor, who will then send it to your appropriate deputy commissioner, who will answer the request along with the Office of the Commissioner. Below, you can find a link to the relevant training on our Freedom of Information Act and confidentiality policy within Train, our learning management system, as well as a link to our Freedom of Information Act policy and our VDH confidentiality policy. Next, we have our use of electronic communications and social media policy. The purpose of this policy is to assure appropriate, responsible, and safe use of electronic communications and social media. This allows VDH to monitor any and all aspects of electronic communications and social media usage that was created, sent, retrieved, received, or posted in use of the Commonwealth's equipment and/or access. Remember to exercise appropriate care to protect the agency's electronic communication tools and social media from viruses, spyware, malware, or other harmful attacks. Be respectful of the agency, other employees, customers, vendors, and others when posting and communicating information. Please ensure the information is accurate prior to posting and that sensitive and/or confidential information is secured properly. Also, do not use your VDH email address when using social media. Please use your personal email address. Below, you can find a link to our Department of Human Resource Management's use of electronic communications and social media policy, as well as a link to the Office of the Commissioner's policy on internet and social media usage. Next, we have our Information System Security Access Agreement. The purpose of this agreement is that it governs the access to and use of information, equipment, and computer systems of the Commonwealth of Virginia and VDH. This includes, but is not limited to, the computer network, all computers or peripherals connected to the network, and all devices and storage media. By signing this, employees agree to not disclose any confidential, restricted, or sensitive data to unauthorized persons, to abide by all federal, state, and agency policies, procedures, and standards which relate to the use of equipment, security of VDH information systems, and the data contained therein. Please take the appropriate information security awareness training prior to being provided access to our information systems. Below, you can find a link to our VDH cybersecurity awareness training within Train, our learning management system, as well as a link to the VDH Information System Security Access Agreement itself. Finally, we have our safety policy, which includes our VDH driver safety policy. The purpose of this policy is that it establishes driver safety and monitoring rules for all employees driving state-owned, rentals, or personal vehicles while on agency business. Representatives of VDH on agency business are expected to adhere to all traffic laws and the rules of this policy. Only employees or authorized agents with a valid driver's license may operate a state-owned vehicle. Cell phones and other electronic devices must be operated via a hands-free device or while the vehicle is in park. No state vehicle may be used to transport alcoholic beverages. Under no circumstance may a state employee operate a vehicle while under the influence of intoxicating beverages, drugs, or other substances. And finally, no person should possess, brandish, or use a weapon that is not required by the individual's position in a state vehicle. Below, you can find a link to the Department of Human Resource Management's alcohol and other drugs policy, as well as our VDH fleet management policy and the VDH driver safety policy. So now that we've gone over all of our policies, you'll probably have additional policies that you'll need to use over the course of your work here at VDH. All of these policies and procedures can be found on the VDH intranet. If you look at the blue link on your screen, it's a link to our intranet, and I would highly suggest everyone save that link into their web browser. You can find a lot of useful information here at VDH listed on that site. Please familiarize yourself with policies such as travel, per diem, how to handle situations with your supervisor, how to submit questions to your shared business service, or SBS, and so much more. Please remember to coordinate with your contracting company for their time card submission process, and also review that process with your supervisor to ensure that timelines are coordinated for efficient pay practices. Here, we have a sample of what the VDH intranet looks like. This is our home page. If you look at the gray box, you can find links to our major areas within the agency. On the far left, we have our administration tab. There you can find a link to our VDH strategic plan, as well if you're curious of seeing our organizational chart again. If you have any questions, you can find a lot of human resources questions answered in the HR tab. Any of the policies today can be found under the policies tab. And if you need help with any shared business services, their resources can be found in the SBS tab. Again, the link on the previous slide should be saved in your web browser, and that will get you access to our VDH intranet when you're using a Commonwealth of Virginia VPN or system. Please, over the next week, remember to review your onboarding checklist. Please ensure that all of your policy certificates are completed and turned in to your HR point of contact within 1 week. Please also complete any assigned training within Train, our learning management system. And also remember to work with your assigned supervisor to learn your role to help make Virginia the healthiest state. Thank you for your time.
Thank you, Eric. As stated earlier, this presentation will serve as an introduction to the required training that you will complete over the next couple of days. I will go over that training plan with you at the conclusion of this training presentation. Our objectives for today is to describe COVID-19 and identify the symptoms of the disease. We will also discuss social distancing, quarantine, and isolation, and describe how they prevent the spread of the disease. We'll define contact tracing, and we'll explain the 4 main steps in the contact tracing process. We'll provide techniques for effective communication that you'll use during your contact tracing interviews. We'll also explain the 4 parts of a contact tracing interview and explain the difference between the 2 types of case monitoring. Lastly, we'll identify resources and services available during the monitoring period. So let's start with, what is COVID-19? COVID-19 stands for Coronavirus Disease 2019. It is an infectious respiratory disease that was initially emerged in Wuhan province, China, in December of 2019. A coronavirus is a group of viruses that can cause illness in people and animals. You will often refer to COVID-19 as considered new or novel. The reason is because coronaviruses in itself are not new, but COVID-19 is new. There are many types of human coronaviruses, one of which is the common cold. COVID-19 is new because it has not been previously seen. The virus is spread person to person through one of the following ways. First, through respiratory droplets or moisture that's released in the air whenever you cough, you sneeze, or talk. It's also spread by touching a surface or an object that has the virus on it and then touching your mouth, your nose, or your eyes. Your mouth, your nose, and your eyes are entry portals for the virus because the virus infects through mucous membranes. You will later hear how important it is to wash your hands frequently and to cover your coughs and your sneezes. Now let's discuss some of the symptoms that we see associated with COVID-19. An individual can be symptomatic or asymptomatic. For our symptomatic individuals, we commonly see them experiencing fever, cough, shortness of breath, chills, muscle pain, headache, sore throat, and a new loss of taste or smell. These symptoms usually appear between 2 to 14 days after being exposed to the virus. Reported illnesses have ranged from mild symptoms to severe illness and, in some cases, death. Asymptomatic individuals would be a person infected with COVID-19, but they never develop or show any symptoms of the illness. Although they are asymptomatic, they can still transmit the virus to others. And as many as 1 in 4 people with COVID-19 may be asymptomatic. So the danger with this is an asymptomatic carrier, they don't know they're sick. Others won't know that they're sick, and that could lead to a false sense of security, which may lead to not implementing prevention methods. In addition to the symptoms that we just discussed, there are emergency warning signs that could occur. And if so, it's important that these individuals seek immediate medical attention. Those emergency warning signs include trouble breathing, persistent pain, pressure in the chest, new confusion, if there's difficulty waking the person up, or having bluish lips or a bluish face. COVID-19 can also cause pneumonia, which will make it very difficult to breathe. In many circumstances, a ventilator may be necessary to increase oxygen circulation in the body. So anyone may be at risk for infection. However, there are certain populations that are at a higher risk of developing a severe illness, if they become infected with COVID-19. Those populations include older adults and individuals with underlying health conditions. Older adults 65 years and older, and also those living in a nursing home or a long-term care facility are at a higher risk for developing severe illness. In addition, individuals with underlying health conditions such as chronic lung disease, diabetes, compromised immune systems, they are also at a higher risk for severe illness. Compromised immune systems would include those who may have cancer and are currently being treated, those who have HIV or AIDS, and also some rare genetic disorders. Children do not appear to be at higher risk for COVID-19 as adults. While some children and infants have been sick with COVID-19, adults make up the most of the known cases to date. To prevent the spread of COVID-19, there are a few things that we should do on a very regular basis. And those are, one, to wash your hands and to wash them frequently. When you wash your hands, wash them for 20 seconds after touching surfaces or if you cough or you sneeze. Make sure you use soap and water. And if you don't have soap and water available, use hand sanitizer that has a minimum of 60% alcohol content. Second, avoid close contact with others. Maintain 6 feet of space between you and others who do not live with you at your home. We'll talk about that more in just a second. Wear a cloth face cover when you're not able to practice social distancing and in spaces where it may be more crowded, such as the grocery store. Wearing a cloth face cover protects you from other people and vice versa. Cover your coughs and sneezes. It's important to do this and to make sure we do it with a tissue and not with your hands. If you cover your cough or your sneeze with your hands, then if you have COVID-19, anything that you touch with your hands will now have the virus on that object or surface. So it's best to use a tissue so that after you cough or sneeze in your tissue, you can discard it immediately. And last but not least, regularly clean and disinfect. Clean and disinfect those surfaces that are in high touch areas, such as your doorknobs, refrigerator handles, your cell phone, light switches, and so forth. Social distancing versus quarantine versus isolation. Social distancing is maintaining space between yourself and people outside of your home, and that should be a minimum of 6 feet. It's very key that we do not gather in groups or crowded spaces. Quarantine is for individuals who have been exposed to COVID-19, but who are not showing any symptoms of illness. They should stay away from others. Because we have not shown any symptoms of the illness, we may not know if our exposure to COVID-19 has meant that the virus has been transmitted to us. So for those individuals, they should limit their movement outside of the home and also separate from others within the home. Isolation, individuals who are sick should isolate themselves from people who are healthy. So if you are sick and you have a confirmed or probable case of COVID-19, you definitely want to isolate yourself from others, including those who you live with in your home. So able, create a sick room in your home that will keep you away from others and stay in that room. Also, if you have multiple bathrooms, have one just to be your bathroom. Avoid sharing cups, eating utensils, so that we can limit the spread of the virus through surfaces and other objects that are shared and touched. Testing. Visit your healthcare provider. That will be our first go-to action whenever we are educating anyone on how they can get tested. So if anyone wants to be tested, they should first contact their healthcare provider, contact your doctor if you have symptoms and think you may have been exposed to the virus. Your healthcare provider will then determine if a test is needed and ensure that process happens if a test is definitely the route that needs to happen. In addition to that, you can find a testing site on your own if you don't want to go or cannot go through a healthcare provider. There are community testing events and also drive-through testing that's available at various local pharmacies, also community centers, and so forth. There is a testing site locator available on the VDH website where our citizens can find confirmed testing sites in their area. Once results are received, if you have a confirmed or probable case of COVID-19, it does require the individuals to stay at home, as we discussed previously, and isolate themselves. There's currently no vaccine to prevent COVID-19, and there are no drugs approved by the FDA for treating the infection. So once a case is confirmed, isolation is key because that will definitely help to prevent the spread of the virus to others. Most people with COVID-19 have mild illness and they can recover at home. Sick individuals should remain home and only leave if they need to seek medical care. Now moving on to the basics of contact tracing. The following are some key terms and definitions that you're going to hear throughout this presentation and also your required training. So we want to go over that now just to prepare you so you will understand exactly what this process is about. The first is person under investigation, which is also referred to as the PUI. The person under investigation is an individual who has COVID-19 and whose past exposure is currently being investigated. A part of that investigation is to identify any individuals that the person under investigation has been around during their infectious period. That person is called a contact. The process of identifying and monitoring all persons who may have been exposed to an individual diagnosed with COVID-19 is contact tracing, and we're going to get into more details about that in just a second. The PUIs and their contacts currently being investigated will make up the case. Now, just to define, close contact is defined as someone who was within 6 feet of the PUI for at least 30 minutes during their infectious period. And a contact can include individuals who shared a close environment with the PUI, individuals who traveled with the PUI or were in close proximities, also healthcare workers who provided in-person care to the PUI. Here are our objectives for contact tracing. We want to identify and notify individuals who may have come in contact with the PUI. We want to identify to what extent the contact has been exposed to the PUI. And we want to establish if the contact is at risk of getting the virus themselves. Finally, provide the contact with the appropriate guidance and resources. Now, there are many roles that will be a part of the contact tracing process. We want to focus on two and go over the responsibilities of each. The first role is case investigator. The case investigator will conduct an interview with the PUI. During this interview, they will also explain the need for isolation because the person under investigation is a confirmed case of COVID-19. During this interview, the case investigator will collect additional information, including contacts who may have been exposed to the virus. The second role is the contact tracer. The contact tracer will be responsible for notifying the contact of their exposure and also explaining the need for self-quarantine. The contact tracer will also perform regular follow-up to monitor the contact should they develop symptoms. And last, determine if there is a need for additional resources or support services. And it's important to note that contact tracers may also assist the case investigator with contacting PUIs and collecting information on their contacts. So let's go over the steps of contact tracing. The first step is the initial notification of the person under investigation. This is initiated as soon as possible after the PUI is identified. Time is of the essence. The faster that we can initiate the notification of the PUI, the faster that we can educate them about isolation and ensure that they have not put others at risk so that we can prevent the spread, and to gather as much information as possible about their activities during the infectious period. The second step is to interview the person under investigation. During this time, you're going to verify demographics, identify those who have come in close contact during the infectious period, link them to medical care, and as we discussed previously, provide guidance on isolation and reducing the risk of spreading COVID-19. Now, in verifying demographics, always verify their name and date of birth to confirm the identity of the respondent. The third step is to locate and notify contacts who may have been exposed to COVID-19. We want to inform the contact of their exposure. However, we are not going to share any information about the person under investigation. Therefore, we may tell the contact that they were exposed, but we cannot and will not tell them who exposed them. During this step, we will also assess for the presence of symptoms and will provide guidance on quarantine and reducing the risk of acquiring and transmitting COVID-19. The last step of contact tracing is to monitor the contacts. We're going to continue to follow up to ensure quarantine guidance is being followed. We're going to track development of potential COVID-19 symptoms, and if they develop, link to medical care, treatment, and testing resources as needed. If a contact ever reports a positive COVID-19 diagnosis, they will shift from quarantine to isolation, and that individual will then become a case. There is a contact tracing time frame. The contact tracing time frame is not the time frame where the case investigator or contact tracer conducts activities for the case. The contact tracing time frame is the first and last day you will ask the PUI about their activities and contacts. So here's an example on how to define the contact tracing time frame. The first step is to determine the date and time the PUI first experienced a COVID-19 related symptom. So let's say we spoke to Mr. Jones, and Mr. Jones let us know that he started coughing on May the 10th. The second thing you want to do is count 2 days prior to the symptom onset date. So if Mr. Jones started coughing on May 10th, 2 days prior to that will be May the 8th. This date marks the beginning of Mr. Jones' infectious period and also the beginning of the contact tracing time frame. The third step is to determine the day the PUI entered isolation at home or in a healthcare facility. So during your interview, Mr. Jones lets you know that he started to isolate at home beginning May the 12th. This date will mark the end of the contact tracing time frame. So for this example, Mr. Jones' contact tracing time frame is May 8th through May the 12th. This is a time frame that during your interviews with Mr. Jones, you're going to ask him about his activities and anyone who he's come in close contact with. Now, while conducting these interviews, it's extremely important to remember that information you collect should remain private and confidential. We are governed by HIPAA, which is the Health Insurance Portability and Accountability Act. The HIPAA privacy rule protects the privacy of patients' protected health information, also known as PHI. The data collected during the investigation is confidential and it must be kept private and secure. Some examples of this information that must be kept private and secure include their name, date of birth, race, ethnicity, contact information, their medical history, their COVID-19 diagnosis, and also their interactions with others. It's important to know that local and state health departments are considered HIPAA-covered entities, and we're allowed to share information for specific reasons, such as contact tracing. The reason being is because contact tracing will protect the health of the public or an individual. It allows us to perform investigations or other actions to stop the spread of the disease. Information collected will be used to track COVID-19 cases, monitor the commonality of the disease, and evaluate the effectiveness of the contact tracing program. Here are some tips for securing confidential information. Do not store confidential information on your personal devices. Please use the agency-supplied equipment to conduct all of your job duties. Do not download information to thumb drives. Also, be aware of others in your workspace. Complete all interviews in a private area. If anyone can overhear your conversation, the information that's being discussed is no longer private and it's no longer secure. Keep your computer locked and password protected when not in use. We don't want to allow anyone access to information that they should not be allowed to see. And do not discuss cases outside of the public health investigation. It's important that we do not discuss any information that comes from our investigations with anyone who is not, where there is not a need to know. Please do not, engage in having, discussing stories about what happened, even if you're not naming the person's name, it's still inappropriate. Do not discuss the case outside of what's needed for the public health investigation. Conducting effective interviews. Prior to talking about those effective communication techniques that will help us to conduct our interviews, it's very important and critical that we take a look at to where we are as far as health equity, because you're going to talk to people from all walks of life, from all races and ethnicities, gender, and so forth. And so the conversations may not be equal. And we want to talk about achieving health equity and also some other things that you need to be aware of during your conversations with some of the PUIs and contacts during your interviews. So health equity is achieving the highest level of health for all people. And that's what we are trying to achieve, health equity. However, there are some health disparities that make it difficult to achieve health equity. And the health disparities are differences in health status among distinct segments of the population, including differences that can occur by gender, race, ethnicity, education, or income. Also included is disability and living in various geographic localities. Health inequity are disparities in health or health care that are systemic and avoidable and therefore considered unfair or unjust. Sometimes when localities and institutions act fast without regard to equity, they are more likely to act on biases that reinforce or generate inequities that negatively impact people of color, disabled people, queer people, and rural communities. So we have to continue to focus on health equity, and it should be centered in our work both in and out of times of disaster. So even though we are focused on the COVID-19 pandemic and we are working to fast, we have to make sure that even doing so, we are still focused on health equity and making sure that we're achieving the highest level of health for all people. The triple aim of health equity is 1, to implement health in our policies, 2, expand our understanding of what creates health, and 3, to strengthen the capacity of communities to create their own healthy future. So how will we do this? Let's focus on cultural competence and cultural humility. Cultural competence is the ability to understand, communicate with, and effectively interact with people across different cultures. Cultural humility is your approach to cultural competence. So the three dimensions of cultural humility is one, a lifelong learning and critical self-reflection. It's understanding that or knowing that we don't know everything, and feeling open to learn from others and allowing people to learn from us. In order to be open to the identities of others, we need to be aware of the perspective that we are applying from our own histories. Be critical and ask yourself why you make the assumptions you do, or what parts of your own life might inform your understanding of others. Also understand that we don't have to be experts on others and their culture. It's just being open to learn and allowing others to learn from us. Second, recognize and challenge power imbalances for respectful partnerships. Recognize when we are in positions of power and take action to infuse the imbalance. Also, take responsibility to point out those imbalances and advocate. Last but not least, the third dimension of cultural humility is institutional accountability, where as an institution, we encourage cultural humility and provide a safe place for individuals to practice. When we actively show cultural humility through the three dimensions that we just discussed, then we're able to have cultural competence, the ability to understand, communicate with, and effectively interact with people across different cultures. Displaying cultural humility will absolutely assist with the population being comfortable and trusting your role in the contact tracing process. We also get a better understanding of other cultures. For example, how oppression or discrimination from the past impacts current beliefs, values, and etc. We also recognize potential differences in the meaning of health and wellness among different cultures. Most importantly, never directly or indirectly suggest that your own culture is better than others. Stigma and discrimination is something else we want to touch on, as this may also be a challenge during some of your conversations. And we definitely want you to be aware of it and be able to reassure any of our citizens who have felt this. So first is stigma. Some individuals may unfairly blame or avoid a particular culture because of fear about COVID-19. And these situations, people are shunned in social situations. They may be the target of verbal, emotional, and physical abuse. And they also may feel isolated and alone. So people of Asian descent would be an example of some who may be experiencing that stigma concerning COVID-19. Because the first case was discovered in Wuhan, China, then, some people of Asian descent have become the targets of verbal, emotional, and physical abuse. Because of this, they may feel shunned and may be less likely to get tested or seek medical care, and may feel isolated and alone. If you speak to anyone who may feel this stigma, it's important that we respect their feelings and we reassure them to help them overcome that stigma. Discrimination is something we also have to be aware of, because there are some groups who may not be comfortable speaking with individuals in an authority role. And this could be based off of previous experiences, negative experiences that they've had, some of which may have been traumatizing. And therefore, they may not be comfortable sharing personal information. We need to acknowledge the experiences of those who have been discriminated against, and also understand that as a case investigator or a contact tracer, you may be looked at as that authority role, and they may not feel comfortable speaking with you. So in acknowledging those experiences, you want to make sure you reassure them that you're committed to protecting their health and their well-being. Self-reflection is key in understanding our cultural competence, being able to handle situations where we speak to people who are uncomfortable based off of the feeling of discrimination and stigma. To prepare for that, ask yourself a couple of questions. What are my personal views and assumptions about different cultures? And how can I learn more about the cultures that I work with? So here are a list of effective communication techniques that you'll want to use during your contact tracing interviews. Some of those techniques I'll go over with you. First, be confident. Show you're knowledgeable and you're prepared. Communicate with empathy and maintain professional boundaries. The next one I want to highlight is to use open-ended questions. Avoid questions where yes or no is the only answer. So you want to start with what, when, how, who, and where. That encourages a conversation. That encourages the respondent to actually talk to you and say more than yes or no. When that happens, you automatically are listening more than you are speaking. And last, I want to highlight, stick to the facts. Educate them about COVID-19. Provide clear information and correct any misconceptions that might be out there. And we know that there are many, but we're going to equip you with the information and current and correct information so that you can educate respondents during your interviews. So when conducting the interview, there are a couple of preferred methods that you may use. One would be a telephone call, also video calls, and the use of a text monitoring system. During your interview, as you collect this data, it will be recorded into an online secure monitoring and reporting system. And it's actually two systems that we will work with. The first one is Sarah Alert. And Sarah Alert will be used primarily by the contact tracers and case investigators. The second is VEDSS, which will be used by the case investigators. You will receive more information and training about these systems during your online modules, which we will go over at the end of this presentation. There may be special circumstances that you should be aware of which will be the respondent who needs an interpreter or one who needs communication services for hearing impaired. So if you speak to someone who does not speak your native tongue, then we will have to engage the assistance of an interpreter for that conversation. You will receive more information on that process. In addition, we will speak to individuals who may have a hearing impairment, and therefore additional communication services for that conversation will be required. As just with the interpreter services, you will receive more information on how that process will be handled. Very quickly, I just want to go over the interview structure. A lot of this we've already touched on, but just want to highlight a few key points of information. So the first step in the interview is to introduce yourself, to confirm the identity of the individual, make sure it's a good time to talk, and definitely explain the purpose of the call. It's also key that they know that the conversation is confidential, so that they will feel more comfortable in answering the questions during the interview. Now, the interview structure is the same for the person under investigation as well as the contact. However, there may be a few differences in the information that is given or requested depending on who you're talking to. So therefore, we have two columns here, the PUI and the contact. Take note as we go through each step because it will clearly lay out what step is for either the PUI or the contact. Step 2 is information gathering and listening. As we've already discussed, this is the time where you are asking for the contact information, who you've been in close contact with, and activities during that infectious period. This is where we're collecting existing medical conditions. We are also collecting information about the individual's potential exposure. We're documenting any COVID-19 related symptoms for the contact and as well. When you're talking to the PUI, we're trying to collect all the information that will help us to get in contact with the people they have been in close contact with. The third step is to provide advice and instruction. And a lot of what you're going to do is provide guidance. So during this step, it's very important that we engage and we build trust. We're also going to offer to connect to clinical services if needed. We're going to provide information on who the contact should call if symptoms develop. So if we need to link them to medical care or have them contact their health provider, that's what we want to do at that time. And plan a future follow-up to ensure recovery for the person under investigation. The PUI contact may be facing many complicated problems. Just know to check with your supervisor on how to handle those situations outside of what you are approved to provide. And the last step is a conclusion. When you are informing the PUI contact that you might be back in touch, give them an opportunity to ask questions. This will also ensure that they are comfortable with the experience, that they get their questions answered, and they're more knowledgeable. And also it will help to reassure the purpose of the call, and they will take your guidance more seriously and quarantine or isolate. You definitely want to thank them for their time and share your contact information. This information that we've just reviewed will definitely be provided to you more detailed during your required training, and you'll receive more information about the interview structure. The last section of our presentation is case monitoring and the resources. There are two types of case monitoring. The first is active monitoring. The second type is self-monitoring. So with active monitoring, we're establishing regular communication with the PUI or contact during the monitoring period. That's basically contact tracing. Self-monitoring is where the PUI or contact is monitoring themselves for symptoms, and they take their own temperature daily. Please remember that contact tracing must be executed with sensitivity. While you are completing activities for case monitoring, please remember the PUI and contact, although they are your case, they are real people, and they absolutely need to understand the work you're doing is to protect them, their friends, and family. It's key that we treat them as if they're not being interrogated. We don't want them to walk away feeling that they are under investigation. So please remember that they are real people and handle the conversation appropriately. As stated earlier, you will be responsible for connecting to resources if needed. And so some of those resources include basic resources and services, which are masks, if they need thermometers, or just more guidance or instructions for quarantine and isolation and social distancing. Additional social support may also be needed, and that would include food, caregiver support, and also maybe child care. So you're going to take care of the issues you can and share information on hotlines or websites that contact can go to for additional help. Also, medical services. And we talked about that. Should anyone, develop symptoms or their symptoms become worse, we want to provide contact information for clinical services. Please remember that the stress of COVID-19 can cause new medical issues and make existing issues worse. So access to medical care is important to aid in recovery. With providing medical services, telehealth is available, where those medical services can be provided via phone or the web, and you'll receive that information to share with your PUIs and contacts as needed. Escalating a case. There will be some situations where you will need to escalate the case to your supervisor, and that would include if the individual has complicated health or support needs, if the individual is in danger of being hurt or hurting themselves, if the individual refuses or is not able to follow instructions for isolation and quarantine. Your supervisor will be able to assist you with finding resources for those health or support needs if you don't know where to send them for assistance. Something else to note is that even though we are providing services and resources to those who may be in need, you are not expected to solve all problems that come your way. You're only able to help with what you can help with. So please do not be discouraged if you're not able to help everyone with all of their needs, but we definitely want to escalate the case to see if there's anything else that we can do if it's outside of your ability or authorization to provide a resource for their specific needs. And that was the end of our presentation, but before we end, I do want to go over the training plan. so that you will have an idea of what to expect going forward in completing your required training to start your job duties. This is the containment project training outline. It is available via a link on our intranet site, and also this will be provided to you via email so that you're able to access your training. So here are the instructions. When you receive the copy of your training outline, please read the instructions before you start. The reason being is because there are two separate training plans based on the two roles we discussed today in our training presentation. If you are a contractor, you're going to follow this training plan. And if you are a case investigator, you're going to follow this training plan. Please also note that testing supervisors will also complete the contact tracer training plan. Regional containment advisors, data managers, and analytic coordinators will also complete the case investigator training plan. Now, what you see here is a link. And once you receive this training plan, you can click this link and it will automatically direct you to Train, which is our learning management system. Train houses our training modules, and this link will take you and will list all of the required training modules for your position. If you are a case investigator or if you are completing the case investigator training plan, you will select this link. And this link will take you directly to the training plan modules in Train, okay? So you can come here based on your position, click either link, and it will take you directly to Train, and it will automatically pull up everything that you have to complete. Just so that you have an understanding of what you will complete, I want to go over those modules. So here you can find a summary of the 3 modules that you are required to complete. The first module is your introduction to VDH and other required policies. So this module will be completed by all of our new hires. Existing personnel who are already VDH employees, you do not have to complete this module, but anyone who is new needs to complete module 1. So earlier in our time together, Eric went over some of the HR policies, and as he stated, there were courses in Train that must be completed and a certificate achieved. And these are the required courses, as he discussed. And this needs to be completed by all roles if you are new to VDH. The estimated time requirement for this is 3.5 hours. Now, here we have additional resources. These happen to be health equity resources. Anytime you see additional resources, it is additional training or additional information that you can read, but it's not required for you to complete, okay? So if you want to learn or read more about health equity and COVID-19, or cultural humility, or health literacy for public health professionals, feel free. This information has been made available for you for that. However, completing all of these resources is not required. The second module is Contact Tracing 101, Introduction to COVID-19 and Contact Tracing. This is a 3-hour course. It is the extended version of the information that I went over with you today. So it will give you more of the detailed information associated with understanding COVID-19 and also the contact tracing process, okay? This is another online module, and the estimated time requirement is 3 hours. Just like previously, there are additional resources listed here that you can feel free to complete, but it is not required for you to complete prior to starting your job duties. The last module is Module 3, and it's Contact Tracing 1 or 2, and this is where we get into those two systems that I mentioned earlier, SARA Alert and VEDSS, which is the secure online monitoring and reporting systems that will be used to record the data that we collect. So as stated earlier, the SARA Alert system will be used by both the case investigators and the contact tracers. VEDSS will only be used by the case investigators. So if you only have to complete the contact tracing training plan, you will only complete the training for SARA Alert. And that time requirement is 3 hours. If you have to complete both, because you are completing the case investigator training outline, then you will complete training for SARA Alert and VEDSS, and that time requirement will be estimated at 6 hours. And that is explained right here. Okay? And again, there are additional resources available, job aids, and so forth that will help. Okay? So, as a recap, you will receive this information in an email, and once you have access to train, based on your position and the training plan that you have to complete, you will select one of these links, and it will take you to your training modules in Train, and it will automatically pull up everything that you have to complete. It's been a pleasure to be with you today. Again, I want to welcome you to the Virginia Department of Health. Thank you for accepting this challenge. We definitely want to help our citizens to do their part to prevent the spread, and the contact tracing process is key in doing so. I look forward to working with you all, and thank you for your time and attention. You have an awesome rest of your day.